Sometimes private companies are seen as in some way wrong in the NHS, but actually they can drive progress. They have brought about some brilliant changes that have enabled people to live healthier lives independently. And I think it's really important that we encourage innovation and technology. We give companies the tax breaks that they need in order to be able to thrive. And I think what really matters is that we make sure that clinicians and innovators are working together to make sure that we get the best outcomes for patients.
When Labour was in power last time, we used private finance in particular areas where you might have a failing hospital and no way of funding it, because there wasn't the money there. So there are places when the private sector can come in and it works. But what this government has done is, through the Health and Social Care Act, is to open up our entire NHS to potential bids from privatisation. So any private company can take over 49% of a hospital, for example. Now, that is potentially dangerous in my opinion, because although the private sector can bring innovation, the people who are looking to take contracts with our health service are often not the small, innovative, interesting tech companies. They are far more likely to be really large giants who are out to make a massive profit. And we've seen that over and over again. And this brings it back to the original question that you asked, Ian, which is, there are massive changes in the health service. We're taking away the boxes between mental health and physical health, or between primary care and acute care, and that opens up huge opportunities for tech companies and other companies to get involved to help with that new process. But too often it is not available for smaller companies to bid in these cases. It is only the large companies that ever manage to get in.
I've knocked on the doors of about 15 to 20,000 electors so far in this campaign, and the NHS is unsurprisingly the #1 issue that comes up all the time. And what people say to me is that the answer is to do with less management and more money. That is the answer, and I think we as a party have made very clear where we stand on that. This coalition government has brought the number of managers down, which went up hugely under Labour, and that has now come down and been replaced with more doctors and more nurses. And we're the only party that said, and here is a great chance to listen to the experts, which all the other panellists are imploring us to do, that the apolitical bosses of the NHS have said we need £8 billion a year more by 2020 to make up the funding shortfall, the gap between patient need and current resources. So surely the answer is to find that money, which we as a party have committed to doing, and I believe none of the other parties, including the Greens, have been able to.
We're talking about outcomes, we're talking about lives and so forth, and so we have to split out the fisticuffs of dawn approach here to actually what actually makes it important for patients to get the right treatment. What UKIP believes is that we should replace the existing monitoring and care quality commissions with elected county health boards, and they will come from people who understand